Well, we're very troubled because this is a drop of aid at a time when needs have increased significantly, in part due to the aftermath of COVID, where African countries already had fewer resources available to deal with COVID than many high-income countries did, used them effectively. But now, as we try and turn to correcting for some of the setbacks that we've seen in COVID, and this time of great need to see high-income countries really reducing their support is very concerning.
Now, during the World Economic Forum in Davos this year, the Bill and Melinda Gates Foundation announced the foundation's largest annual budget to date. What strategic considerations and priorities are driving this increase?
Yes, well, the biggest is really the reflection both of need that we just discussed, where we have seen some of these setbacks, and we do believe the resources are needed more now than ever. So we want to put our money where our mouth is, and if we're calling on others, on governments and philanthropists to step up and provide more resources, we feel it's important that we lead by example and do that ourselves. And so that's why it's not just an increase year on year, but we've actually increased by a couple of $1 billion over the last 5 years, partly reflecting those challenges. And the kind of areas that we're looking to work on is we do believe it's possible to accelerate progress dramatically through investments that we have made as a foundation and other partners. There are new tools from AI devices that can help with maternal child health care, handheld devices that we've helped support cheap and usable across the continent of Africa, new treatments for malaria, tuberculosis, new investments and treatment in drought and flood resilient livestock and seeds for smallholder farmers across the continent of Africa, that if we can get those rolled out, we can see huge acceleration in progress, reductions in preventable mortality, increases in agricultural productivity and income generation. And so that's what we're hoping to see and accelerate.
What other insight can you provide into how the incremental resources for 2024 will be distributed across diverse priorities for maximum impact?
Yes, so it's across a range of our work, and we work across health and agricultural development, financial inclusion. We are particularly focused on health, partly because that's where we see those needs and opportunities. So some of it is hopefully continuing the fight against polio, where we are the largest funders globally, where Africa has been declared wild polio virus free, but we do have some vaccine-derived outbreaks across the continent, which we need to tackle with treatments and campaigns that we'll be supporting and increasing our funding for. There are new treatments being rolled out, for example, higher technology malaria bed nets that are able to deal with mosquitoes that have evolved to be resistant to the first generation of bed nets, which we need to get rolled out at scale. Some of those agricultural interventions I talked about, the climate adaptation, we're expanding those drought-resistant poultry investments across multiple countries from Nigeria to Ethiopia to Kenya to Zimbabwe. And so we're very excited about those prospects, and that's where a lot of our investments will go. But for us, it's a both and. It's not just about the new money. It's our existing commitments at scale and where we can double down and hopefully become even more effective and impactful.
How does the foundation track and evaluate the impact of its initiatives, and what metrics are used to assess success?
So I always like to say at the foundation that we are about impact first, and impact is measured not by how much money we spend, even if the budget number is the headline, but it's the impact we have in terms of lives saved from preventable death and opportunities provided for the poorest and most vulnerable. So we track that very closely. You track that, for example, do HIV antiretroviral treatments reach the people they need to? Are the prices of those treatments down and effective enough that they can be accessible even to the very poorest? Are vaccines reaching children even in very isolated areas? Are they? And we can track them. So, for example, we can have sort of microchips on bed nets in places like in West Africa, where you can make sure the bed nets are being distributed to the areas that are greatest need. So it's very core metrics where you're tracking both the final outcomes, but some of the intermediate metrics of, are the tools and products reaching the people they need to.
This year's annual letter emphasizes the role of philanthropy. How can philanthropy continue to adapt and evolve to meet the changing needs of the continent while ensuring not to overstep the line concerning the role of governments?
That's a very important distinction, because we have to say governments and communities need to be in the driver's seat. That's the only way you get long-term sustainable development impact at scale. And so we're always working to be in alignment with governmental priorities. But what we can then do is take risks that governments can't do. So, for example, I've mentioned potential research into a new malaria vaccine, an mRNA vaccine. We'll also be launching trials on the continent of Africa for the first new tuberculosis vaccine in over 100 years. Those are big risks that governments actually can't afford to tackle. It takes multiple years. It takes, in this case, hundreds of millions of dollars to do the tuberculosis vaccine. But that is exactly the kind of opportunity where I think philanthropy can and should take the risk. It may fail. The private sector is not willing to invest in it because the people who get tuberculosis live in poor countries and won't pay for a potential treatment. But philanthropy can step in and fill that gap. And so I think at that catalytic risk-taking thing, we can test some of the models for AI and education in low-resource settings. And then if we prove them, we'll turn that government and say, okay, it's your job to scale that up, but we'll take the risk for you. And so I think it's very much a partnership that we want to establish and build on.